Assalamualaikum. Today we want to present our group assignment for Public Policy POL 3123. The title was Mental Health Policy in Malaysia. My group member are Nur Maisarah binti Maslai, Nur Amalina binti Yaakob, Nurul Atikah binti Awi Sakurni, Heza Hazwani binti Hernawan, Nur Ain Natasha Aida binti Zawawi, and the last one was me, Siti Nur Azira binti Su. Today, we want to talk about mental health policy and the issue in our country. Introduction. The capacity of the individual, the group and the environment to interact with one another to promote subjective well-being and optimal the use of cognitive, effective and relational abilities toward the achievement of individual and collective goals consistent with justice. They was started in 1911 of custodial care. Their national mental health policy was established in 1998, followed by development of a 5-year strategic plans. Mental health policy construct with 9 policy. 1. Accessibility and equity. Ensure equal access to the mental health care for every segment of the population according to the geographical and economic accessibility. 2. Comprehensiveness. Ensure provision of a comprehensive range of the mental health care and service which include promotive, preventive, treatment and rehabilitative activity. 3. Community and integration. Service will be available in the primary healthcare and integrated in the existing programs. Multi-Sectoral Collaboration. The Ministry of Health will play a lead role in facilitating multi-sectoral collaboration and cooperation between mental health service and program. Community participation. The community should participate in planning, management and evaluation of community-based activities. Human resource and training. Planning and development of human resource for mental health to meet the needs of the country. Standard and monitoring should be provided with big quality of care and standard. Research should continue will be implemented and funded by the public and private sector. The last one, legislation. The right and civil liberties of persons with mental health problem and mental disorder.
Next, I want to talk about issue and problem. Firstly, increasing commit suicide in Malaysia by involve emotional disturbance and can affect their life by being tired, stressed, and thus not interested to continue living. Often caused by stress in workplace, bully victim, and feel disappointed by certain problem. Because of that, these policies are supposedly to help them by giving treatment so that they can through their life peacefully. Next problem is with support among young generation. Young generation always being ignored in this problem because mostly categories like adult, elderly, drug addict will be their priority by giving treatment. It is because the treatment can help them improve their quality life to do beneficial things and can fix their psychology function, social and economy in contribute country productivity. Not only that, there is also a society that cannot afford to get treatment from private hospital. For example, the charge of treatment hike was giving them hard time to get treatment. This matter involve government, private and community association. To get this treatment will involve government, private and community associations. Therefore, having a charge in a primary hospital can allow them to get a treatment at a lower price. This is a little bit helpful. They can get medication, treatment, consultants, doctor appointments, and their health will be reduced and always be supervised by a doctor wisely.
I will explain how mental health policy work. First, offer a solid foundation for developing a country's strategy. This is to ensure that every aspect of planning and implementation is enhanced and kept able to bring it well to the people. Secondly, strengthening mental health service for people who are at risk of developing psychosocial issues. This is to guarantee that each community mental health is always steady and healthy. Lastly, psychiatrist treatment that for people with mental illnesses are being improved. This is to create opportunity for family, community, and other connected body to request care and protections.
Alright, I will continue with theory use in mental health. Refer to the DASS inventory issued by the Ministry of Health Malaysia. Mental health categories study include stress, level of stress, depression, and anxiety individuals. There is two theory, which is psychoanalytical theory and humanistic theory. First of all, the psychological study of depression was started by Sigmund Freud and Carl Abraham. Both illustrate that depression is a complex reaction to loss. Freud in his book Mourning and Melancholia describes that normal feelings or sadness and depression in response to lose someone or something he loves. The person who in depression will usually result a remarkable reduction in self-esteem and experience ago poverty on a large scale. Other than that, in humanistic theory, according to Maslow, 1970 hierarchy of needs self-perfection, showing human characteristics such as the ability to see oneself and the environment has high efficiency, loving attitude, and home association. The failure of the individual to meet the requirements of self-perfection will cause the individual to feel lost or frustrated and not have satisfaction in his life. Maslow also argued that each individual will bring with him or his interests, attitude, and desire on their workplaces. Maslow also gives that view of humans have 5 levels of a hierarchy waiting to try. Maslow theory in 1984 strongly emphasized on mental well-being. Other than that, according to Maslow, that if psychological needs are not to met by the individual, one's soul will be disturbed and restless. In analysis and discussion, next, the challenge that causes on individual mental health decline is stigma and discrimination against the mental ill is still rampant. Attitude the generation public against illness and the mentally ill has changed, as stated by Minda Kami, Head of Creative Communication by Zulaika Muhammad. They then see the public perspective on their mental ill is in a negative direction and not giving moral support so that they can heal. For example, society label the mental ill this is drama or fabrication. because of their attitude. Therefore, patients this mentally desperately needs unbroken support from people around them, either family members or friends, to treat them well. This is a way that to treat their mental ill or problem. In addition, prior treatment and feedback from doctor and nurses and expert the family also cause an individual's mental level to deteriorate. This matters so because there are patients who are treated badly, that is fired and expelled, as well tortured by their own family members for not being able to accept their own situation. Furthermore, this will result in an increase in mental disorder and suicide rate in Malaysia since a decade ago. According to the research officer of the Galen Center for Health Policy and Society, JC, the B40 population is at high risk to get for mental health problems as a result of their difficult living conditions. This also has a significant impact because they are the ones who cannot afford to go to private clinics and can only seek treatment at public health care center. Okay, I will pass to Hazel Hazwani for the conclusion. Thank you.
I am Nur Amalina, will continue the presentation. The effect of mental health policy. Able to guarantee the right and freedom of people with mental health problems is that to provide protect to them. Among them is placing them in specialist care center or hospitals to receive treatment. The Ministry of Health Malaysia plays an important role in working with other sectors to reduce mental health problems among Malaysia. The cause, the fact to be defendants and not left without receiving special treatment.
Hi, my name is Herza Hazwani. I will continue the presentation. Conclusion. In the conclusion, the mental health policy introduced by the Malaysian government, it is an alternative to defending the fate of individuals who are experiencing this problem. Mental illness can affect humans through rate to out of control, which this policy it will help to provide place for mental patients to receive treatment, medicine, and expert appointment. If they have already recovered from the period, follow-up treatment is given to them to monitor their level of health performance. That's all. Thank you.